2013 proved to be another year in which our staff and physicians dealt with substantial challenges and yet still achieved remarkable results. This past year, there were over 66,000 visits to our emergency department. This was 5,000 more visits than the previous year, making HSN one of the busiest EDs in the province. Yet the overall length of stay of emergency department patients improved by 2 hours. Ambulance offload times were almost cut in half and are now 22 minutes better than the provincial average. The time for getting a hospital bed for ED patients being admitted has decreased by 17 hours from the previous year. On doit grandement attribuer le mérite à toute l'équipe du service des urgences concernant l'adoption de nouvelles méthodes visant à améliorer l'accès aux soins. Des améliorations ont également eu lieu dans d'autres secteurs de notre hôpital. We admitted 250 more people to hospital this year, bringing our total annual admissions to well over 22,000 patients. Yet, despite this increase, our length of stay is among the best in the province. The number of alternate level of care patients in the hospital has dropped considerably over the past year. We've reduced ALC numbers by 50%. This is due to the incredible collaboration between HSN and key healthcare partners such as CCAC, St. Joe's Health Centre, and the Northeast LHIN. D'autres progrès sont nécessaires. Les premières réussites, nous les devons à toutes les personnes participant directement aux soins des patients, qu'il s'agisse des médecins ou des infirmières, des aides de médecins à domicile ou des familles. Another area of progress for HSN was seen in its academic mandate. And it's not insignificant. We increased our number of learners of all disciplines at HSN. Over 1,800 medical students, nursing students, and allied health learners received valuable training at our center. Not only are they learning, they're also providing direct frontline care to our patients. Approximately 1,000 learners and employees logged over 10,000 hours in our state-of-the-art simulation lab where they are learning new skills and honing existing skills. Cette année, nous avons mis sur pied de nouveaux programmes et services, tout conçus pour améliorer les soins aux patients. Our surgical program has always been renowned for its innovation, and this year proved to be no different. Notre équipe chirurgicale a réalisé des nouveaux types d'opérations qui améliorent les résultats pour les patients et accélèrent le temps de rétablissement. One of our surgical teams performed HSN's first ever transoral laser microsurgery. It uses a laser to remove a tumor in a patient's throat. There's no external excision and therefore no scarring and significantly faster recovery times. We've also begun to perform laparoscopic hysterectomies, which involves minimal scarring, reduced risk of postoperative complications, and significantly quicker recovery period. Deux nouvelles interventions cardiaques sont maintenant offertes à l'hôpital Santé-Nord. Dans le premier cas, soit un remplacement valvulaire aortique à effraction minimale, on pratique une incision aux 2/3 des plus petits que s'il s'agissait d'une intervention standard. The other is a mini thoracotomy, which a small incision is made to insert an electrical lead on a patient's heart, which is then connected to a mini defibrillator implanted under the skin. This helps synchronize a patient's heartbeat. Another excellent example of innovation is the introduction of our new virtual critical care unit, the only service of its kind in Ontario. It uses the latest video conferencing and electronic health record technology to link our intensive care unit with smaller hospitals in northeastern Ontario. This will allow these smaller hospitals to have instant, live access to HSN's expertise to improve patient care while reducing the need to transfer patients. At the Northeast Cancer Centre, a new method of radiation therapy called SABR or SABR was introduced. With pinpoint accuracy, SABR administered doses of radiation 6 times stronger than traditional therapy. There's less impact on surrounding tissues, and patients can complete their radiation therapy in as few as 4 treatments compared to over 30, with potentially better results. In our family and child program, frontline staff, physicians, midwives, and managers completed another phase of the MORE OB program. L'approche multidisciplinaire en prévention des risques obstétricaux, AMPRO-OB, est un système de formation qui constitue une pratique exemplaire contribuant à la normalisation des compétences et des protocoles pour l'ensemble des professionnels et professionnels de la santé travaillant dans le domaine de l'obstétrique. Il en résulte une communication et une collaboration accrue entre les professionnels. These are just a few examples of our physicians, nurses, allied health professionals, and leaders have embraced innovation and taken the initiative to improve care for our patients. The result is HSN is clearly becoming a destination of choice for some of the best medical talent available. This is not just a statement, it's backed up by hard data. Since 2002, Greater Sudbury has enjoyed more than a net gain of 100 new physicians, almost half of whom are specialists. Il y a eu bien des réalisations à l'hôpital Santé-Nord depuis un an. But we know there are still a number of systemic challenges facing HSN and all major hospitals across the province and country. They include extremely busy emergency departments, longer than desired wait times for some procedures, and a high demand for acute care beds. These pressures will remain as long as we exist in a climate of an aging population, increased levels of chronic illness and disease, gaps in community care infrastructure, and limited public funds. Ensemble, ces facteurs continueront d'exercer une pression soutenue sur les ressources de soins actifs des hôpitaux. But I can assure you that HSN is advancing at a remarkable rate as one of Canada's emerging academic health science centers. As a frontline physician and as chief of staff, I'm confident HSN has the people, the willingness, and the ability to meet these challenges. Thank you.